Now here's your host, Ken Gross.
Good morning. Welcome to Law and Reality. Today's segment, we're going to cover Metro Detroit Health Insurance Program. Let me introduce Tom Berkowitz. Tom, welcome to the show.
Thanks, Ken. Thanks for having me.
But the Metro Detroit Health Insurance Program is a unique story, and I want to go through and explain to you why we're covering. It's a charity, and I would say with extremely unique features. And these are the two that I think are the most unique, that intrigue me. One is there is no overhead. All people that are involved in the charity are working without compensation, donating their time, and 100% of all contributions to the charity go to help those that are intended to be helped by the charity. And first of all, Tom is the board president and volunteer administrator and founder. Grew up in Oak Park. You got a BA in education from U of M. What does Metro Detroit Health Insurance Program do? How does it work?
Well, it works by providing financial assistance to low-income uninsured people. The Affordable Care Act, whether you like it,
also known as
Obamacare, whether you like it or not, it's the law of the land, and there's subsidies offered to low-income people. Okay, anybody making 400% of the poverty level or below gets some kind of subsidies, and it gets larger and larger till you get down to the people that are close to Medicaid, which is 138% of the poverty level.
So if you get the subsidy, what do we need? What does the charity do?
The charity fills the gap. For example, people making minimum wage full time, that actually makes too much for Medicaid, but they get very large subsidies. You know, the problem is that even though the insurance may be discounted 80% or 90%, they still can't pay
can't
it.
Afford the other 20%.
They're living paycheck to paycheck, yeah, it's impossible. Even if it's a $600 a month, value, that's to them $80 a month. They don't have $80 a month.
And then, if I'm correct, if they don't actually have the health insurance and they have income, then they could be penalized on their taxes under the
It's really
Care Act,
harsh.
right?
The low-income people really are hit hardest by the penalty. Yeah, maybe I should say the Affordable Care Act now requires people to have health insurance. It's the law. You have to have health insurance if you make more than the Medicaid income level.
And then if
you don't,
you get penalized.
You get penalized. So here, the poor people.
And then they come to Jenny with a tax problem.
Yeah. And it's going to be a big problem.
I'm seeing a lot of them right now being
It's going to be a big problem.
No
I think that in 2016, the penalty goes up to $695 per adult.
But if I understand it correctly, what it comes down to is people are, if you're above the Medicaid level for income, but below reasonable compensation, you don't have enough money to pay for the insurance, even your share.
Right.
Your charity is covering that gap.
We fill the gap between what they can afford and what the cost is.
How does it work? So as I understand, if you're uninsured and you earn too much from Medicaid,
right,
but earn below the 200% poverty level, that would be
That's
the
our
range.
niche
What's the
topic.
difference between bronze plan and silver
There's
plan?
bronze, silver, gold, and platinum.
Right.
Okay, and this is designed to try and get people up to silver, right?
Yeah, we only allow silver plans. Bronze plans have deductibles of like $5,000, $7,000, $9,000, $11,000. A poor person can't ever use that. There's a special provision for the silver plan where government provides cost sharing to low-income people who buy the silver plan. That's why we go for it. The government sort of buys down, or probably offers the insurance company money to provide very low deductible, very low max out-of-pocket, very low copay. So they're tailor-made for low-income people to actually be able to use them.
So the silver plan has a variability.
So how do people
go?
Did they go to your website to apply for the program?
No, actually, I'm glad you asked that. We have partnered with many this is what I've been doing for a year, calling and trying to find social service agencies that partner with us. And I've been doing,
I'm
pleased to say we have like 34 different enrollment places around the Metro Detroit area where people can go.
And you can find all of them on the website. We got a couple minutes left. Give me, what things do you want to leave us about MDHIP so that people know?
Yeah, well, I really want to stress, when I created this, I was really looking for a place to make a huge difference. with no overhead. And in our program, like I said, we have no overhead. I pay our phone line myself, and that's about all. Their PO box, you know.
There's also a match on the
Yeah,
contributions.
there's a 100% match to contributions. But the real beauty of the program is that we can piggyback off the federal tax subsidies. So, for example, you know, a person may get a $5,000 subsidy, but they can't take advantage of it. But if we can add another $500 to what they would have to pay to get it, then suddenly they have, you know,
Well, let me put it
like
in
for
numbers.
each dollar. Let me just say, for
yeah.
each dollar donated, we can buy insurance from $5 to $70 for each dollar,
the
depending
dollar
on the
donated,
recipient.
The dollar match is 2, you get $70 donated out of it. So if we
Right,
got,
it's a
so I
huge
sent you a
impact.
check for $250, all of a sudden
Yeah,
we're
it's
buying
worth thousands
50
of dollars
yeah.
of insurance.
It's really a great thing. I want to kind of wrap things up to say the reason why I had you on the show is because you're doing something 150% pure charitable. There's nothing in it for this guy at all. All the time, everyone in the organization is working for free. You've got a founder that's doubling, a benefactor that's doubling the contributions that are made. I wish there were more people like Tom Berkowitz out there.
Well, and thank you for donating.
I appreciate the favor.
Fav Gross, by the way, is a donor to our program, and thank you so much for having me on.
Thanks for being with us, Tom. Good luck with the charity.
Thank you very much.